Welcome back to Squawk Box. Over the weekend, the FDA granted emergency use authorizations to Quiddle for the first antigen test for COVID-19. The new test is believed to be generally faster, cheaper, and easier to manufacture than most current diagnostics, as it relies on decades-old technology. In his latest Wall Street Journal op-ed, former FDA Commissioner Dr. Scott Gottlieb says antibody testing could be the key to stopping the spread of the coronavirus if we make sure the tests are reliable. Dr. Gottlieb joins us now. He's also, of course, a CNBC contributor, serves on the boards of Illumina and Pfizer, and it's great to see you, Doctor. Just walk us through the importance of this, how it works, and how it could be a game changer.
Well, this test tests for antigens that the virus produces in the blood. So it has antibodies effectively on a stick, and you swab someone with that stick. Those antibodies bind to antigens that are produced by the virus. These are particles on the surface of the virus's coat. And then you put it in a little machine called a Sophia that's about $1,000 and has an installed base right now of about 40,000 machines in doctors' offices, because doctors use these machines to test for flu and strep throat. And then it changes color, and you can get a readable result right there in the doctor's office. It takes about 5 minutes. The test itself probably is going to cost about $5. Now, the problem with it is it's only about 85% sensitive. So that means if you have 100 patients with COVID come into your office, you're only going to catch 85 of them with this test. The other 15, you're going to have to send off a PCR-based test. You're hopefully, as a physician, going to have enough suspicion that when you get the negative result, you're going to say, well, maybe this is a false negative. Let me send a confirmatory test. But the virtue is, for the first 85 patients, you've now effectively diagnosed them right away in the doctor's office in about 5 minutes, very inexpensively, without having to reflex, without having to send off a PCR-based test. So this really does expand the ability to test in the doctor's office, and it's another tool. It's another layer of testing. The company itself has about 200,000 of these kits that they can send right now, but within several weeks, they'll be up to 1.5 million a week. And this is just the first of probably a number of these approvals.
Doctor, here's the question, though. If the accuracy level is only 85%, does that mean that any time you get a negative test, the doctor's going to want to do a second test? And if not, what are we doing? And can this test improve over time?
There'll be other antigen tests that probably will be above 90%, but that's why these should be done in doctor's offices, and that's why the flu and the strep test are good tests when used in a doctor's office, because if you come in with strep symptoms or flu-like symptoms and you use one of these rapid tests and you get a negative test, the doctor's probably going to treat you anyway in the interim and send off a more accurate test like a PCR-based test and wait a day to get the result back. But for the vast, vast majority of patients who come in with symptoms and have the disease, these antigen-based tests can catch it. So it's a good first-line tool. It's not the kind of tool you want to use in the community to screen asymptomatic people, where if you get a negative result, you're unlikely to do anything. So this isn't the kind of test you'd want to use in a place of employment just to screen your employees, or even in a place like the White House, where they're screening people before they meet with the president who are asymptomatic. In those circumstances, you want a test that's far more foolproof, like the Cepheid Gene Expert or a PCR-based test.
Speaking of that, Doctor, I was shaken a little bit about Vice President Pence and some of his people and the Secret Service agents, and I think the FDA commissioner is you're the former, but the current one is quarantined too. I mean, it's got awfully close to the leaders of this country, including President Trump, who's, I don't know if he has comorbidities, but I know he's healthy, but he's in that age. It's kind of frightening, is it not, that it's that close to the White House and everyone that works there? We're going to have Navarro on later today. I'm going to ask him as well. But should we be concerned?
Well, look, this is very contagious. I think if they were setting up a screening process in the White House, they should use a very sensitive machine for screening people who are going to be meeting with the president. They're using the Abbott machine right now, which is that machine that can turn around a result in 5 to 10 minutes, up to 15 minutes. It depends on how you run the test. That machine itself isn't 100% sensitive. I think when you're using a machine to screen asymptomatic people, where if you get a negative result, you're likely to assume with a high degree of certainty that the patient doesn't have the virus. So when you're using it in that situation where you're screening people who don't have any symptoms, and you're likely to say they're all clear if you get a negative result, you want a machine that's very sensitive. The only machine that's a point-of-care machine, or can be used as a point-of-care device, that gives a pretty rapid result that's very, very sensitive is Cepheid's Gene Expert. That's it. The others all have a lower sensitivity. The Abbott machine, these antigen-based tests, there's other machines in development that should be on the market soon that all will have a lower sensitivity in the 80s, maybe 90s, but not 100%.
Hey, Scott, you've been pretty cautious yourself with your family, trying to make sure that you're doing everything you possibly can to keep them safe. But you had said several weeks ago that if you were called to Washington, you'd go there because you think that's important. Given all of these cases that are now popping up in and around the White House, would you still do that at this point? Would you still go to Washington tomorrow if called?
Well, I would. I mean, but I'd take a lot of precautions if I had to travel. But if I had to travel for Congress or for the White House, I would make the trip, given what I've been doing to try to be helpful. But I think that there's a lot of things you could do to be very careful in terms of wearing face masks, hand coverings, cleaning your hands, watching how you travel. Not everyone has the opportunity to take the kinds of precautions that I could take. So it's difficult right now to travel for people who don't have access to both the equipment as well as the modes of transportation that could be a little bit safer.